showing the paper again. All right, so now we're gonna move into the physical exam. First, I'm gonna test short and long-term memory. Short-term memory is just asking what today's date is, I guess. Or, the 3 objects, yes. So I'm gonna say 3 objects and I'm gonna have you remember them later on, okay? Folder, cup, and table. Folder, cup, table. I'm gonna say that.
Folder, cup, table.
And in a couple minutes, I'm gonna ask you that again.
Okay.
Long-term memory is going to be the 3 presidents. Can you name the last 3 presidents in order, starting from the most recent?
Biden, Trump, Obama.
All right, good. Long-term memory is intact. Previously, we also did seeing alert and oriented times 3. Those were asking the month as well as where she is today. Can you repeat those 3 objects again?
Folder, cup.
2 out of 3 is good enough. So you have short-term memory is intact. All right, so now we're going to move into the cranial nerves. I'm going to do it from here. Also, I'm going to wash my hands before we begin the physical exam. All right, so first we're going to test cranial nerve 2, which is going to be visual acuity. I'm first going to also go over the vitals. The vital signs are within normal limits: temperature, pulse, blood pressure, respirations, and then the visual acuity is OD, OS, OU, 20/20 as well. So it's cranial nerve 2 is intact. Now we're going to do 3, 4, and 6, and that's visual fields. Can you go ahead and just look straight ahead and follow my finger with your eyes? All right, good. 3, 4, and 6 are intact. Now we're going to do cranial nerve 5. So first I'm just going to have you close your eyes. I'm going to use these, and you're going to tell me when you feel it on your cheeks. All right,
Okay.
Go ahead and close your eyes.
Now.
All right, good. That was the sensory branch of cranial nerve 5. Now we're going to do the motor branch. Go ahead and just open your mouth and go side to side. Good. So 5 is intact. Now we're going to do cranial nerve 7. You're just going to do a bunch of different facial movements. Go ahead and smile, frown, puff out your cheeks. Don't let me push them in. Close your eyes. Don't let me open them. Good. Now we're going to do cranial nerve 8. Go ahead and close your eyes and tell me which ear you hear it on. Good.
Both.
All right, perfect. Now we're going to do cranial nerve 9. That's going to be, and also cranial nerve 10. Go ahead and just stick out your tongue. So that is cranial nerve 9, and then 10 would be the gag reflex. Cranial nerve 11, go ahead and just shrug your shoulders against me. Good. And then go ahead and look that way. And just resist. Good. Look the other way. And resist. Good. And now cranial nerve 12, go ahead and stick your tongue out and move it side to side. And move it side to side on your cheeks as well. All right, so cranial nerves are intact. Now we're going to do the head exam. First, I'm just going to palpate. I'm just palpating the cranium. All right, and then also I'm going to percuss the sinuses. These are the frontal sinuses, maxillary. All right, now we're going to do the eye exam. I'm just going to do visual fields first. So I'm just going to have you look straight ahead, and then out of the corner of your vision, you're going to tell me what you see, okay?
Okay. 1, 2. 1, 2.
All right, good. All right, now we're going to do the shining the light. So I'm just going to put my hand here. I'm just going to do this one. Good. All right, pupils equal and reactive to light. Now I'm just going to check the conjunctiva and sclera. First, I'm just going to shine a light. I'm going to also turn off the lights. I don't even know. Okay, good. And I'm just going to shine the light. So I'm going to use my left hand to do your left eye. So I'm looking at the conjunctiva, sclera on this side, and then I'm going to do the same thing on the other side as well. And you're going from lateral to medial. All right, now we're going to move on to the ears. First, I'm just going to inspect. I'm just inspecting the orchotragus and mastoid process on both sides. Now I'm going to palpate. All right, and now I'm just going to look in both ears as well. There would be something on here, so I'm not actually going to do it, but I'm just going to pull and look on either side. All right. Now we're going to do nose. First, I'm just going to test the patency, so I'm just going to have you plug one nostril and breathe in and out. Good. Plug the other nostril, breathe in and out. Cranial nerve 1 would also be the sense, and then I'm just going to have you look up. Or sorry, just look up at the sky with it like this, and I'm just going to look in using my light just to check the septum as well and for any bleeding. All right, now now I'm going to do the mouth. So actually, I need this again. Sorry, I'm just going to inspect the lips first. Go ahead and open your mouth and stick out your tongue. I'm also inspecting the teeth. Go ahead and just smile. Teeth and gums and the oral mucosa as well. Go ahead and open your mouth again. I'm just shining a light to look for the tonsils too. For the neck, I'm first just going to feel the trachea. Go ahead and swallow. Good, and I'm just going to feel the lymph nodes as well. All 10 pairs of lymph nodes. Go ahead and look down. In the back as well. All right. Now I'm going to do the thyroid exam. Oh, and then the ranges of motion. I'm going to do the thyroid first. So I'm going to go behind you, and just so you know, I'm going to be putting your hands on your neck, if that's okay.
Okay.
All right, I'm just putting my hands on either side. Go ahead and look towards your right knee. Look down and towards your right knee. Go ahead, I'm displacing and palpating with my right. Go ahead and look up again. Go ahead and look down and at your left knee now. I'm displacing and palpating as well. All right, and then the neck ranges of motion. Go ahead and just follow me. Look up, look down, and then side to side. And then ear to chin, ear to shoulder as well. All right, and then now I'm going to do the respiratory exam. For this part, we're going to go to over here as well. I have to get my stethoscope. All right, I'm going to move it just so we can see better. Okay. So first I'm just going to inspect, inspecting the AP lateral diameter. I'm also just going to inspect the respirations. I do this for about 30 seconds while distracting the patient as well, just making sure that they're equal and unlabored. First I'm going to palpate, so I'm going to do the back first, so if you can just turn this way so we can see the screen. All right, so I'm palpating the 7 posterior areas, 1, 2, 3, 4, 5, 6, 7. Then I'm going to percuss those same areas. And now I'll be doing this under clothing as well, which I'm actually going to redo it, so I'm doing it under clothes. So now I'm percussing. Sorry, it's kind of hard to do this without that. All right, and then I'm going to listen to these areas as well. Hopefully it's still recording. And I'm just going to do this as well under the clothes. So I'm just going to have you take a deep breath every time you feel my stethoscope. Go ahead. 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6, 7, and 7. All right, perfect. Now, I always do CVA tenderness. I know this is part of the abdominal exam, but I'm just going to tap on your back as well to elicit any CVA tenderness too while we're doing this. All right, now we're going to do the anterior aspect. We're going to do the 6. So first is going to be palpation. So 1, 2, 3, 4, 5, 6. And then we're going to percuss these. This would also be under clothing, but for the sake of this, I'm not going to do that. But always under clothing. All right, now we're going to auscultate the 6 areas as well. Go ahead and take a deep breath every time. That's 3, 4, 5, and 6 on the other side. All right, now we're going to do the cardio exam. So first, the bed would be at 30 degrees for this, so I'm just going to have you lay back. And first, I'm just going to have you turn your head to the left, and then I'm going to use a light to shine and approximate the JVP. So this should be pulsating right here. It's between the trachea or the carina and then the on the neck as well. All right, now we're going to do the percussion or the palpation of the 5 areas of the precordium. So it's just going to be on this side. I'm just palpating 2, 3, 4, 5. All right, and now I'm going to auscultate first with the diaphragm and then with the bell. All right. the peripheral vascular exam. So first I'm just going to check for capillary refill. So go ahead and just hold your hands out like this. Actually, hold them like this, sorry. And then you do it on 3 here, and we're making sure it's less than 2 seconds on either side. And then we're going to do the pulses here. All right. And then we're going to do this, and then this would be under the socks as well. We would do, I wouldn't do this right now because I don't want to wash my hands again, but you would do the capillary refill on the lower extremities, then you would wash your hands again as well. And then I'm just going to check for pitting edema both on the upper and lower extremities. So on this side here, and then I'm going to lift and also inspect here, and then you can feel for temperature as well. All right. Now we're going to move on to the abdominal exam. So first I'm just going to inspect. I'm going to have you flex your legs and then lay back. Good. And if you can just lift your shirt so I can inspect first. So I'm just first inspecting for any scars or striae, and then I'm going to auscultate. Auscultating with the diaphragm on all 4 quadrants. And while I'm auscultating, I'm also going to look for any bruits. So I'm going to use either hands here on the abdominal aorta to look for bruits. And then I'm auscultating with the bell of the stethoscope here as well to listen for any bruits. And then I'm going to percuss. All right, and then I'm going to do both light and deep palpation. So light first. And then I'm going to do the liver border. So the liver border is going to be on the right side. And then all you're going to do is take a deep breath in. And then I'm just hooking under there. And then also palpate the spleen, breathe in again. All right, good. And then you can put your shirt down now. So now we're going to do the musculoskeletal exam. We can go back over here too so we can see better. All right. So first thing for the musculoskeletal exam is just inspection. So I'm just inspecting the upper extremities as well as the lower extremities, and then we do bony palpation. So we're going to start up here, and then we're just going to work our way down. We're doing bony palpation as well as palpation of the muscles on either side. All right, good. And then now we're going to do range of motion. So first we're going to do the shoulders. So you're just going to come out, back in, up, and all the way down. And then this way, and then this way as well. Now we're going to do muscle strength for the shoulders. So go ahead and just put your arms out. I'm going to come behind you on this side, and then we're going to test on either one. So we're testing on this side, and then we're testing on this side to make sure that we're doing both at the same time. Go ahead and flex your arms now, like this, and that's the same one on this side. And then you push back against me. Push back. All right, good. And then we want to do the internal external rotation too. So go ahead and do it like this again. Try to push out against my arm and in. And then on this side as well, out and in. All right. Now we're going to do the elbow range of motion. So just flexion, extension, pronation, supination. Good, and then you're just going to hold your arms out like this. Flexion, push up, and then push down against me. Push down. And then I'm going to hold your hand like this. You're going to try to go this way, and try to go the other way too. Good. Same thing on this side. Go this way, and try to go the other way. All right. Now we're going to do the wrist range of motion. So flexion, extension, inversion, eversion, and circumduction of the wrist as well. So then I'm just going to have you push down, push up, and then push outward, push inward. And then, sorry, I should have been comparing, so it should be what each one we are doing. Go ahead and go this way. Go ahead and go that way. Inward and outward as well. All right. And then the last one is just the finger range of motion. So you're just going to go inwards, outwards, and then circumduction as well. Your thumb. All right. So So now we're going to move on to the lower extremities. So we'll just go back over there. So first we're just going to do the inspection as well. So we'll have her lift up. Yeah. And then we're just going to do the palpation starting with the ASIS. So here, and then we're just palpating the muscles as well. Go ahead and flex your legs, palpating the knees, and then the back, and then down as well. And the bony process is here. And then we'd also do the feet, but again, for sanitation purposes, I don't want to wash my hands. Now we're going to do the hips. So first we're just going to have you move up your knee. So just flex it up. Good. And then go inwards and outwards. All right, good. And back down. Same thing on the other side. Move up the knee. And then you go this way. Good. And the last one is going to be the extension. And then we'll check the muscle strength as well. So go ahead and just flip over. And I'm going to put my hand here. Go ahead and lift your leg up to my hand. Good. And then lift it up and then the other way too. Perfect. And then lift it up and then don't let me push down. Good. Same thing on this side. Good. Testing muscle strength of that. Then we're going to do the knees. So go ahead and sit on the edge. And then I'm going to move the camera too. All right. And then I'm going to have you just kick out your knee and the other one. Good. And then you're going to kick out against me. And then go backwards. Kick out against me. And then go backwards. All right. And then the last one we're going to go and do it here so then your ankles are hanging. And then it's just going to be, hold on. I'm trying to see. Oh, it's hard to. All right. Good. There you go. All right, so we're going to have you go, first we're just going to have you go inwards, outwards, and then down, up, and then around. All right, good. And then first I'm just going to have you go push down, like you're pushing gas pedal, push up, and then go inwards, and go outwards. And then ankle clonus, you just go like this. And then we would compare on either side, so go up and down, inwards and outwards, and then same thing, ankle clonus. All right, so that concludes musculoskeletal exam. And then I'm going to wash my hands really quick here. And then lastly, we're going to do the neuro exam. So for the neuro exam, we're going to do, first we're going to do finger to nose. So all you're going to do is put your hand to your finger, put your hand to your finger to your nose, and then go out to my finger, good. And then go back, close your eyes now, and then touch my finger and touch your nose, good. Now you're going to do it with the other hand. So put your other finger on your nose, then go out to me, go back, close your eyes, good. So finger to nose is intact. Then we're going to do rapid alternating movements. So all you're just going to do is go like this on either side, good. And then heel to shin. So same, you're just going to take your heel, go to your knee, and go all the way down to your shin, and back up. Good, now you're going to do that with your eyes closed. So go to your, yeah, perfect. On the other side too, open your eyes, do it once, and then close your eyes and go back up and down. All right. And then we're going to do the spine palpation as well as the ranges of motion and the gait, and then that concludes the exam. So first we're going to just do the spine. So go ahead and just stand there, perfect. And go ahead and I'm going to put my hands here. First I'm just going to feel the spine, the bony processes of the spine. Go ahead and bend forward too. And then I'm just going to look for the curvature of the spine as well. Good. Now we're going to do the spine ranges of motion. So go ahead and go down, touch your toes, come back up and arch your back like that. Good. And then look on either side. Turn and turn. Good. So spine's a full range of motion. Last thing we're going to do is the gaits. And then we'll do the Romberg and the pronator drift as well. So go ahead and just walk normally to the end. Turn around. And then walk on your toes. Turn around. Walk on your heels. Turn around and then do a tightrope walk. All right. And then the last two are going to be the Romberg. So you're just going to hold your hands like this and then close your eyes. And then for 30 seconds, you would wait. see if there's any balance issues. All right, and then the last one's a pronator drift. Go ahead and hold your hands out like this. Go ahead and close your eyes. All right. That concludes our physical exam. Thank you.